Welcome to this talk and a welcome back to Dr. Michael Cohen. Michael, thank you so much for coming back.
Very welcome. Lovely to see you.
A topic that causes a great deal of distress, that's almost socially unacceptable to talk about, and it's infertility. And in my experience, I don't know about yours, when people start talking about infertility, they tend to think something wrong with the woman, kind of what I would call Henry VIII syndrome. but what is the kind of reality of the situation?
Well, I think very often there are issues with the woman, but I think that I would like to concentrate on the other side of things at the moment, and we'll talk briefly about the woman. But I think the thing that often doesn't get spoken about, because women very much become the focus of the attention of the fertility doctors and everything, and very often the male side of things is kind of like, oh well, it looks like there's enough sperm, maybe, whatever, or they don't necessarily even get checked for a while, and often there's a bit of hesitancy, I should say, from the side of men to get checked, because they just assume that if they can ejaculate, if they can have sperm, then there's no reason for there to be a problem, really. So I would like to really focus on that side of things today.
Yeah. And men tend to, I don't know, the more egotistical, aren't they? There can't be anything wrong with me, sort of thing. It's
it's a kind of there is something to that. There's just a feel. It's just a feeling of like, no, I'm fine. And I think people, I think they kind of shy away from actually wanting to deal with it, because it's like, oh, it's probably just a woman problem. I'm sure I'm fine. That kind of thing. It's that male thing.
I think a lot of us men have denial in quite a few areas, to be quite honest, but we'll pass on rapidly from that.
Yes. Yeah, exactly.
I think these things often are kind of a rule of thirds. A third of the time the man, third of the time the woman, third of the time it's a combination. That's not a scientific statement. But
it's not scientific, but it's. I think there's a lot of truth in that.
There's
a lot of truth in that.
Yeah. How long? Let's suppose we've got a young couple, just got married, 25 years old. Normal early marital activity. What sort of time frame, if they're both healthy, would you expect it for conception to take?
I mean, usually at that sort of age, you'd expect them to get pregnant very, very quickly. I mean, you're talking about a matter of weeks or months. We often say that, we wait for a year before starting to investigate, especially when they're younger. As people get older, of course, there's more stress involved, and people are starting to worry, and it's considered that the woman could, the egg quality could be worse, and therefore it's better to move at an earlier stage. But very often I see couples where the man is, let's say, in his early 40s, and the woman may be 30 or 35 or something like this. And so there's quite a bit of stress in the whole situation. Or sometimes they're earlier, they're younger, and they can also be in this very stressed situation, like, oh no, what's going on? Why can't we get pregnant? And so I thought I'd want to focus today on the side of the men.
Yeah, absolutely. Is this something that you can diagnose as a doctor, Michael?
Yeah, definitely. I've seen many couples over the years, and there's a pattern that when you catch it and you take it seriously, it means that you can often avoid sending the couple for IVF, which I think is hugely important. A lot of the time people have this reflex in medicine to go to IVF.
Go to the high tech.
Go to the high tech, or to treatments that involve hormones that they themselves are pretty stressful. They have risks, and I've seen this time and time again. And I've also seen the times when people didn't go for IVF and they tried other things. And that's not to say that IVF doesn't have a place. It definitely has a place. But very often I think that there are earlier interventions that could be done, and that I've seen many times succeed.
And we don't want to medicalise what should be a wonderful, natural process.
Absolutely. It's a beautiful process. It's a shame to medicalise it at such an early stage. But I've seen even like slightly older couples, as it were. I'm not talking about old. I'm talking about older, who they would normally be very quickly pushed down the route of IVF. And I've seen ways, you might make a couple of adjustments for the woman. She may have a couple of vitamin deficiencies, maybe a bit of an iron deficiency, and you assume that that's it, but then actually there's some other problem going on with the male. And I guess if I was to talk about it, I'd talk about a typical couple, let's say, without going into any specifics, trying to identify anyone, of course. But the story that I see often starts in the same way. They come in, they're struggling to conceive, they're stressed, and the first appointment usually focuses on the woman. As we said before, it can't be the man, it's the woman. So we make sure that the woman is okay, and we find out if there's any deficiencies or whatnot. I always insist on the man having a sperm test as well. So they have a sperm count, and then when we see those results, and I have to tell the man, look, we have to talk about this, it can become a bit awkward for them, but inevitably they have to deal with it. And I thought that we should talk about all the aspects of what that means for a male. So
absolutely.
First of all, yeah.
But the sperm test is just literally that. A semen sample would be taken in.
Yeah.
The pathologist
sample
would look at it under the microscope.
Yeah, exactly.
Yeah. And the man could look sort of healthy, fit, athletic, macho.
Completely. And very often they do. They do, which is why
yeah.
there's often more surprise, because you're not looking at necessarily someone who's sick or anything like that. You talk about people who look and behave in a healthy manner. They may be burning the candle at both ends at times, but they don't put any real importance to that. So I've seen people who look healthy and they have what's known as severe oligozoospermia, which means basically that they have a very low sperm count, very poor motility, so the sperm are not moving very well. The morphology, the shapes of the sperm is abnormal, and perhaps surprisingly, what's considered normal by the WHO classification is around 4% morphology. So 96% of the sperm doesn't have to look normal. You only need 4% to look normal, and that's considered normal enough to conceive. And many people have that sort of range of sperm. It may be a bit higher, but many people have that, and that's considered normal. And what I'm talking about is men who come in who have either got 0 or 1% of what's known as normal morphology. And so then the question is why? And what can we try to do in order to improve that situation, if anything? So that's what I'd like to talk about today.
So interesting, isn't it? Of the 100 or 200 million sperm, in a particular event, only a few % of those have got the potential to actually produce a fertilization.
Absolutely.
Should we start with genetics?
Sure.
Michael, sure. Is there some genetic conditions that men can have that means they're going to have pretty well guaranteed problems in this area? Yeah,
so first of all, there's a region on the Y chromosome, so the male chromosome, which is only for males, which is called the AZF region. And if that region is missing, I'm talking about, it's called a Y chromosome microdeletion. That area is actually missing, then it doesn't matter what you do, you are not going to be able to get them to produce sperm by making any changes in their lifestyle, in their sleep, smoking, supplements. Nothing's going to help. And in those cases, they really need to be seen by a specialist, a fertility specialist. They will need to have some kind of sperm harvesting procedure, so actually, and hormones and all sorts. So you're not gonna otherwise manage to help those situations. But most men that I've ever seen, even the ones who've got very low sperm counts, don't have that problem. And so we go on to other things rather than, once I've checked someone for that, in this typical couple that we're talking about, the next thing is really to check for other things that I find are useful.
Is that a routine blood test, by the way, the microdeletion?
It's a specialised genetic test. It won't come up with normal genetic screening. You'd have to ask for it very specifically.
But you send off some blood and the geneticists do their clever stuff. And
exactly. Yeah.
I suppose there's a range of AZF deletions as well, which could cause partial fertility or complete.
I actually don't know enough about that. What I do know is that if there is a deletion, that's it. There's no way around it.
Yeah, the main thing I know about genetics is always more complicated.
far more complicated than what I learned about. That's for sure.
Yeah, but no, that particular deletion means that you're not going to have a natural conception.
Correct. Correct.
And so you can, I suppose, you can do a physical examination and make sure that the morphology is normal, and then I'm guessing the next thing might be some blood work. Any particular diagnostic tests that you'd like to look for in men?
Yep. So there's a number of tests that we usually do, but this is what I want to talk about because this is really the surprising part. Most of these people don't have any very surprising abnormality. They have slightly off figures usually, so they may have a slightly low testosterone on the lower range of normal. Their LH and FSH, the luteinizing hormone, and their follicular stimulating hormone could be slightly elevated. So it suggests that the brain, which is producing the testosterone, the glands in the brain that's producing the testosterone,
or the testosterone will stimulate the testes to produce the testosterone.
Right. So it shows that it's working hard, but it's not managing to actually get.
So the brain's saying, "Come on," and the testes are going. Yeah, got it.
So they're not cooperating with the brain, basically. Then you do other tests, checking their thyroid gland, checking their prolactin, their liver function, their kidneys. Very often you find everything is pretty much normal. I'll always check their other things like vitamin D, B12, folic acid, iron, a number of different things, their blood count, of course, to see what their nutritional status is. Now, very often you find these very minor abnormalities and nothing very specific that is going to explain everything. Even saying that, you need to check and do these tests and then try and make corrections for these things. But really the things that are going to matter first are things like sleep and alcohol consumption. So sleep is a bit of a surprising one. Most people don't realize because they may be hardworking and going to sleep late and waking up early and perhaps waking up a couple of times in the night. And sleep is incredibly, incredibly important for sperm production, for healthy sperm production, because every 90 minutes or so during sleep, there are pulses of this hormone, luteinizing hormone, and that comes out of the pituitary gland in the brain. And basically it causes this is supposed to happen every 90 minutes, and this cycle of pulses that come out from the brain are responsible for the testosterone that's actually produced. And so if you're not getting good sleep, good quality sleep and sufficient sleep, you are going to have problems producing enough testosterone.
And you need the testosterone to stimulate the formation of the spermatogenesis. That's
correct. So it goes to the Leydig cells in the testes, and that's what produces the actual sperm.
No, the testosterone. The Leydig cells produce the testosterone.
Sorry, yes.
Yeah.
Yes.
Yeah, testes are complicated. It's the lining cells of the tubules. I can't remember, Michael. Inferviews tubules or something like that. Yeah, but I remember that interstitial cells of Leydig produce the testosterone.
Yes.
Yeah, mine aren't producing as much as they used to, unfortunately. But there you go.
But basically, if the sleep is cut short, then the LH pulses don't fire cleanly, and basically you don't get the testosterone produced, and that's
and people don't realise the importance of. I mean, I think sleep's one of the most underrated things for general health and well-being.
Absolutely. It should be a public health matter.
Yeah, and it isn't. You know, you'll see things on cigarette packets saying "Don't smoke."
Correct.
But you won't see things on beds saying get plenty of sleep.
Absolutely.
And it's massively important for so many different things. So again, it would be simply discussing this with a couple, how they can optimize their sleep.
Yep. I can tell you there's studies in the past. They've done one, I think, back in 2011, where there was 1 week of 5-hour nights in healthy young men, and their testosterone dropped by about 10 to 15%, and that didn't happen over years. That was in just 1 week. And other studies that have shown if you've got severe sleep deprivation for 3-4 days, the testosterone could be suppressed by around 50%.
Wow.
So these really have significant effects. It really does have a significant effect on testosterone production. And it's even been shown that men sleeping less than 6 hours a night had, per cycle, a chance of conception of something like 40-50% less than men who are sleeping 8 hours a night. So this is hugely important. It's hugely important.
Big factor, yeah. And we both know what it feels like to try and do clinical work at 4 o'clock in the morning. And
right, exactly.
Shifts. She must be a problem for shift workers then, really.
It's a huge problem. Yeah. And I suspect that many of those people who do work on shifts end up needing fertility treatment at the end of the day, because it's very hard to reverse these kinds of lifestyle measures unless you take serious time out of work to do that.
Or chat with the boss and see if you can do some shift adjustment for
something like that.
A period of time. I mean, we have all these rights about maternity rights and paternity leave and all this kind of thing, but we should have some conceptual rights as well. I would have
for sure
thought.
For sure.
It's not ludicrous by any means.
No. If you want to have a new younger generation and that's healthy as well, that's what's needed.
If you're trying to conceive, then these adjustments need to be made because they're very reasonable adjustments. I suppose a classic one that people think about is stress, all sorts. I mean, it could be the stress of having difficulty in conceiving, and that can make the actual physical act really quite problematic sometimes, especially for men. But work stress, life stress, family stress, financial stress, do all these things sort of accumulate?
Yeah, I mean, chronic stress activates the hypothalamic pituitary axis, and that affects the adrenal gland as well, and cortisol goes up. Cortisol suppresses gonadotrophin releasing hormone, and that has a result which causes a lower luteinizing hormone signal, and again that results in reduced testosterone and worse spermatogenesis. So the production of the sperm is impaired. So sleep deprivation actually suppresses the testosterone pulse from one end, and then you've got chronic cortisol suppressing the gonadotrophin releasing hormone signal from the other hand. So you've got literally two hands squeezing the same problem.
So the stress and the sleep really go together, the lack of stress, the too much stress and the sleep. And I suppose looking at just from a sort of a hunter-gatherer point of view, if you're being chased by tigers and the other tribe and you're in a high stress situation, then reproduction is not the body's first priority, it's survival.
Right.
We are designed to survive. Quite nice to have a glass of wine after work to relax. So I've been told.
Yep.
Alcohol an issue?
Yes, it's very much an issue, and actually it's much more of an issue, I think, than it's made out to be. So, people often think, well, it's okay having a glass of wine at night. If you weren't in this situation of having problems with your sperm count, I might say, okay, well, we know that it's not ideal, it's not the healthiest thing, that we can have a discussion about that, because I actually think in many respects having some alcohol is actually a good thing, but it's more philosophical than medical. When it comes to what we're talking about, which is male infertility, the way to handle this is actually to address everything at the same time. So we're talking about sleep, we're talking about stress, we're talking about literally going without any alcohol for a period of 3 months. To make the changes that you need. I
agree completely. It
takes 70 to 90 days to produce a good batch of sperm, and to have that on cycle. And so, if you have not been treating your body well in that period of time, you're going to have problems creating good sperm.
And as well as that, it's a couples thing, isn't it? We know women shouldn't be drinking round about the time of conception, certainly not in the first 3 months of pregnancy. And for dad to be sitting with a glass of wine while mum's not, this should be a completely joint effort. And
for sure,
and both stop drinking altogether for a period of time.
For sure, and for men, presumably for women as well, alcohol is literally a direct toxin to the testes.
Yes.
So, and that's not at any catastrophic quantities. Even just a few drinks on most evenings will do it. And the mechanism by which it does it is going back to the Leydig cells. So it impairs their function, and those are the cells that actually produce testosterone in the first place. And it causes the increase of conversion of testosterone to estrogen, and it also directly damages the DNA of the sperm in the first place. So you've got a number of different things going on here at the same time. And they all, if you were to see most couples, these are fairly normal behaviors for many young or middle-aged people. That they go out a couple of times a week, they drink a couple of times, or 2, 3, 4 times a week. They go to bed late. They may be not sleeping well, waking up a couple of times, especially if you drink alcohol as well before you go to sleep. It often causes a disturbed sleep pattern. So you've got all of these things going on together, and most people would consider them pretty normal things and nothing that really needs to change. And they think, well, maybe I need I need to change something in terms of needing a supplement or whatever. And we'll get onto that as well next.
I have a normal life, doctor. What are you worried about?
Exactly.
Yeah.
So the definition of normal in this context really has to be looked at differently.
Yeah. So there you are, men. If you want less testosterone, more female estrogen, if you'd like to develop breasts, reduce the size of the penis and testes, and reduce your muscle mass, feel free to drink lots of alcohol, because alcohol doesn't make you more of a man; it makes you more of a woman. I think is that a fair summary?
Couldn't have said it better myself.
Yeah, absolutely. I've got a few other sort of curveballs to throw in here, Mike.
Yeah,
if you don't
for
mind.
sure.
Temperature. For some spooky reason in men, the testes are outside the body because they like to be at 35 degrees centigrade.
That's correct.
So saunas, hot tubs, all that sort of stuff, is that going to affect sperm quality, do you think?
I haven't seen the studies on that. I would assume that it could have an effect if it was done excessively. I certainly think that not having tight underwear is a good idea. So you want to have loose underwear.
Yeah,
you don't want the sperm getting hot and sweaty the whole time and close to body temperature. And sperm are produced at a lower temperature than the rest of the body. So the rest of the body is functioning around 37 degrees and sperm production happens around 35.
As indeed does testosterone production. Quite fascinating.
Yep.
It's all geared to 35 degrees centigrade.
Yep.
Practically, sex frequency and time of the month, if you're trying to optimize conception, is it worth counting so many days after the last menstrual period and focusing on that area?
I think so. And with women, if we're going a little bit onto the side of the woman for this segment, but basically, there are tests for ovulation as well, because women can ovulate more than once in a month. Some women ovulate multiple times, and it can be difficult to predict. So the normal time of ovulation around the middle of the cycle is the time for you to be trying, for men and women to be trying, and usually it's probably a good idea to be trying every second day, so allowing the sperm to build up a little bit and then trying every second day around the middle of the month. But again, with the kind of timing kits that you can buy from the pharmacy, you can actually time things even more accurately than that. And it's definitely, that's the time to be having relations.
Yep. And typically I think that ovulation occurs about 14 days before the next menstrual
prior to
cycle.
The next period, exactly.
Yeah, so it means if it is exactly a 28-day cycle, which might not be that common, then ovulation is likely to occur on day 14. So sexual activity day sort of 13 is probably the most likely time to.
Yeah, but 13 or 14, 15, 16, you want to be catching on to that.
That's right, yeah, because sperm doesn't actually last that long in the female tract, does it? The viability is probably only 12, 24 hours. It's
something like that. I think I have read that it can last longer. It can take longer than that to
Oh yeah, sometimes it kind of jellifies and can stick around for a while. It's a bit complicated. Anyway, but bear in mind we are giving advice now on optimizing conception, not on how to prevent conception. Two completely different topics. So interesting lifestyle factors. Zinc and other nutrients in men. I'm thinking zinc's quite important for sperm quality.
Yep. So there's a few different things that I personally test for at times, or sometimes don't test for, but definitely recommend, and they're done in safe quantity. So I'll start with zinc if you like. Zinc is safe to be given at. I just want to say first of all, this is not medical advice for anyone specifically.
This is entirely
general medical information,
and
and people should go and discuss these things with their own doctor.
Always see your own doctor.
Absolutely.
And Dr. Cohen's full as well. I don't think he's taking any more patients. Thousands of people ask, "Can you be my doctor, please?" Sorry, I just...
No, it's okay. Zinc. You want to be taking around 25 milligrams a day. Yep. You don't want much more than that because, first of all, it does help with testosterone synthesis and sperm formation. As I said, you don't want to be taking more than about 25-30 milligrams a day. Very often the over-the-counter preparations contain 50 to 100 milligrams. So you have to be really careful because high doses of zinc actually depletes copper in the body, and that can even have neurological consequences, and that's not something on the label. So I would be very cautious about that. That's one thing. Another Another supplement that I tell people to use is something called L-carnitine at a dose of 2 to 3 grams per day. And this is considered a fuel for the mitochondria for the sperm. And it's really actually got the best evidence out of all the supplements, with multiple randomized controlled trials showing an improvement in motility of sperm. So that's
L-carnitine.
L-carnitine.
It's normally in meat, is it?
Yeah. But you can buy it as a supplement.
Got it.
Another one is coenzyme Q10, ubiquinol, ubiquinone, 200 to 300 milligrams a day, and that assists with mitochondrial energy production. And there is a signal that it actually improves morphology and improves DNA fragmentation. And that's very important because at the ages that we're talking about, a man in their 40s, their coenzyme Q10 levels start to decline. So that's actually very important. Another important one comes from Brazil nuts, believe it or not, selenium. So you don't need to buy this. It's very cheap. You just need to eat 1 or 2 Brazil nuts every day, and that should give more than enough of your daily requirement. So and it's basically essentially free and safe. Most people are not allergic to Brazil nuts. Another supplement, very important, is omega-3. So 1 or 2 grams per day of mixed EPA and DHA, which are important because they are a part of the sperm membrane, the head and that's the part of the sperm that actually fuses with the egg. So the other way to do it is to have 2 or 3 tins of sardines per week, or the equivalent amount in salmon. Food is always the best. Fish is a very good source. And algal oil, if someone is vegan, you can have algal oil, which is the actual form that the fish are basically eating in the first place, and that's
because the fish don't actually make the omega-3s.
That's correct.
It's the plankton that actually make the omega-3s.
Yeah.
So people are now actually farming marine algae and extracting the oils directly from it.
Yeah.
And
I believe there are specific algae that are good for this.
That's my understanding.
It's not all algae.
Yeah, I think even some freshwater algae can do it if you've got the right strains. But
I didn't know that.
Yeah, but the marine ones are obviously the ones to go for. Yeah.
Then there's also vitamin C, 500 milligrams twice a day. It's a very safe dose for a period of time. And the seminal fluid, the fluid that the sperm swim within, contains very high doses or very high amounts of vitamin C. And that's actually a defense against oxidative stress.
Yeah,
so
it's protecting them against these nasty free radicals.
That So, and the other thing about vitamin C is it's important to take it twice daily because it's water soluble. It actually goes in your body and out of your body very quickly. It has renal clearance. It goes out through the kidneys. So it's very important that you take it twice a day because otherwise you're probably not getting the maximal benefit from it. Another vitamin to think about is vitamin E, around 400 international units per day. It's fat soluble, it's an antioxidant in the sperm membrane as well, and it works together with vitamin C. So that's another very good one. Another one is NAC, N-acetylcysteine, which you know very well, John, I'm sure, because I think you used to work in emergency, right?
For paracetamol overdoses.
For paracetamol overdoses, it's basically the precursor to glutathione, which is the body's master antioxidant. And there have been randomized control studies in the past which showed improvements in sperm count, in motility, in morphology. So that's also very useful. So 600 milligrams a day of that. And the other one I was going to mention is vitamin D3.
Yes. Yep.
But only in people who've got a suboptimal level. So if you've got a level of vitamin D3 of 40 to 50 nanograms per deciliter, which translates to around 125 nanomoles per litre.
Yep.
I can't remember in England.
It's times 2.5. We use nanomoles per litre.
Right. I've seen both being used, but yes. So you want to make sure if they've got a good level, they don't actually need supplementation with vitamin D3 at that point. But many people do not have those sorts of levels, so it's something worth checking.
Most people don't. I wouldn't have thought.
Yeah, I would have thought that as well. I was going to say something as a caveat here, which is that the individual evidence for each of these supplements is not perfect. A lot of the trials are very small. They're heterogeneous populations. The combined effect of them does seem to support the biology. They don't replace lifestyle changes. You still need to do the stuff with stress. You still need to do the stuff with sleep. You still need to avoid alcohol. All of those things, but they can be very helpful. And I've seen time and time again when people's sperm counts and sperm morphology has been returned to normal, and they've gotten pregnant without any IVF.
And you might not know what particular factor it is, but
that's right. But it's a very safe strategy. You're looking at something that's very cheap, very safe, and you're also going to do this for a limited period of time. I always tell people, this is not an indefinite thing. You're going to do this for 90 days seriously. And both the man takes his side and the woman takes her side, and very often they get a result which avoids them going down the route of IVF. Fertilization.
I'm just sure there's so much unnecessary IVF done in the world at great expense, great pain, great emotional distress, and to be quite honest, it produces lots of spare embryos, which
is not at all ideal.
It's it's the whole question of when does human life begin. Comes into that, but we're not going to cover that today, but it's interesting. So if you put all your cases together, you've got sort of a composite case. What sort of level of success are you getting with this strategy that you use as a general practitioner?
I honestly can't tell you a clear answer to that. What I can say is that I have seen it work so many times now that it's always, unless there are some extenuating circumstances. Even I can tell you stories about people who I can think of one of my patients right now going back a few years when they were really stressed and they wanted to have children, and they came into the clinic and they were asking me about which specialists I could advise them for fertility, and I said, look, let's just do these basic tests first. They did them, and I told them what to do according to the results. And I never saw the man was my patient, and I never saw him again for a long time. And it wasn't because anything had gone wrong. Actually, he came back to see me a few years later, and they'd had 2 kids, maybe 3 kids even. I can't remember, possibly 3 kids. And he said, we didn't end up going to any of the specialists. We just did these things, and they got pregnant, and they were so busy in the last 4 or 5 years that I never saw them, and looking after these 2-3 young kids. So that's just one story, but I can tell you so many stories about similar cases of patients who just they thought that they were going to need IVF, and they even went down the route of all the tests that they needed to do for IVF. You can do these 2 things in parallel with each other. You don't have to do one or the other. You can start the process with this and that. And I can just say that many times people did not need to go down the route of IVF, and it turned out that it was due to stress. It was due to other lifestyle factors, too much work stress, drinking too much, not sleeping. It's remarkable, and the mind-body connection is also incredible. I'd like to tell you a very brief story, if I may, about a patient, a couple who had they were convinced they couldn't conceive, and they were not old. They were, I think, in their sort of they were around 30, that sort of age, and they went so far as going through a surrogate pregnancy. So somebody else carried their genetically their genetic child, and I can tell you that there was nothing actually wrong with them, and I know this because they then went on to conceive 2 other children completely naturally, and that is the power of the mind-body relationship in this regard, and we can go into it in many other respects, but that is a very powerful story. That once they realized that they were okay, when they relaxed, once they had a child, I should say, they then relaxed and they were able to have more. Naturally, without surrogacy.
So some really mind-body connections, some really basic interventions, really basic advice, and that can be what makes all the difference. That's the difference between success and failure. It's
absolutely
really quite incredible. So many things are basic, so many things are simple. We need to, in medicine and I guess in life generally, we need to cover these basic variables first. Very often the main things are the plain things, and the plain things are the main things, and yet these are the things that are so often neglected because it's not high tech, it's not clever, it's not look at how clever this consultant is. It's just really basic.
Yeah, I mean, it's the stuff. It's basic physiology in medical school. Honestly, it's basic physiology, and the cost of not doing this, the cost of someone going down the route of IVF if they didn't need to. Yeah, I'm not talking about nobody needs to go to IVF. There are clearly people who need IVF, and that's the right thing for them, and etc. And they may, by the way, do all of these things and still can't conceive, and therefore they should be definitely looking at IVF. They shouldn't just be saying, "Oh well, I'm going to keep trying this. It's not working after a significant period of time." They should be looking at IVF. The cost of the IVF, and I'm not talking about the financial cost because that can also be quite significant, but there's very much an emotional cost. There is a relational cost. It's not easy on the relationship. The hormones can be very difficult for many women, and some women can end up having things like ovarian hyperstimulation syndrome, which can be quite dangerous. And I've had a patient just a few months ago who was hospitalized for 10 days, and they'd been told by the consultant they're going to be fine, it's not a big deal. They got unlucky, but they were hospitalized for 10 days with significant complications. And you see, all of these decisions need to be taken with a lot of care and humility and follow-up.
Yeah. Just a quick fire round to finish, I think, Michael. Why is the male factor still investigated second, typically?
I don't know, but I'm guessing that there is a kind of resistance, a bit of a cultural thing, a bit of an emotional thing, a bit of what we spoke about earlier, which is that men tend to push back a little bit harder and say, "Oh, it can't be me. Look, I'm fine." It's like, and there are also cases where a man has gotten a woman pregnant in the past, and so he assumes that there's no reason why he can't get this woman pregnant. They're in a different relationship, but it could be that something's changed in the meantime. Very often something has.
Of course. What's the real cost when IVF reflex fires prematurely? So, going straight to IVF, I think we've probably covered that. But I like the expression there that you have used, the IVF reflex. Let's not have this as a reflex. Let's reflex onto the simple things first.
I think it goes into many areas of medicine today that there is this reflex to do something always, and that doing something is something medical. Now, I'm a medical doctor, and I generally agree with a lot of things that happen in medicine, but I think that we can be too quick and too reflexive to do things as to diagnose a specific problem, as it were, and then say, okay, you need this treatment, and this treatment is often some form of medication or drugs or things that can have side effects or unexpected consequences. And I think we should, it's not that I'm ever against that. What I'm against is that these things should happen first. Very often, for many different conditions, it's possible, and usually talking about more chronic conditions. I'm not talking about if someone's got a high fever with a stiff neck and they've got meningitis or something. I'm going to tell them to go and try some herb first. I'm going to say get yourself straight into the emergency department. But for more chronic conditions, there are many such conditions. Very often we need to optimize the person's health as a first step.
Yes. And I like the expression we should think before we have the audacity to intervene. Because it is an audacious thing to intervene in someone's life, isn't it?
Yeah.
When you think about it. So vitamins, the gap between there is evidence and this product will fix you is a problem, isn't it? People tend to think supplements are fixers, whereas obviously vitamin producers and supplement producers are trying to sell them.
Of course,
the whole quality governance there, a bit of a problem, I think, in that area. I mean, that's probably a topic for another video. But
it is, and people talk about the pharma, big pharma, but there's also a big nutraceutical industry. The supplement industry is also huge, and it also has its interests. And there are people who have ridiculous supplement stacks at home that they're taking, a lot of them without any clear rationale or benefit. Correct. But some study somewhere that showed something, and
some place someday a few years back in
yeah.
No, I agree completely. It annoys me that sleep isn't more talked about as a public health intervention. for fertility and everything. I think we really need to do much more focus on sleep. I mean, immunity, chronic disease, metabolic syndrome, pretty well everything really.
Yep.
Does explaining mechanisms actually change patient behaviour? Do you find that when you sit patients down and talk to them, they actually do change their behaviour after that?
I think, I certainly give a lot of credibility to my patients, and I think that very often if you actually spend a few minutes explaining the reason for something, people take it on board. And when it's something serious that really can impact their life and impact their ability to have a child, they very often will, they will listen. No, I can't say always, and it's dependent on so many other factors, but in general, I like to have faith in my patients, and a lot of them do deserve that.
I agree. I might be talking to someone and I might suggest something. They said, I've been doing that since you suggested it 3 years ago. It is kind of nice. And the other thing about that person not coming back, it just occurred to me, maybe we can judge our success by how little thanks we get in this kind of work, because once someone's better, think, I'm better now, I'm off, let's live the rest of my life, So in a sense, the less thanks we get, the better.
Well, very often you end up wondering what happened to someone, and you only find out a lot later, and you're glad about it, but it's like when people are stressed, they tend to need you, and when as soon as things have calmed down, they forgot that they ever even saw you. And it's always lovely to have, a year later or something, some kind of follow-up, whether it be incidental or otherwise, that you actually end up finding out what happened to them, and that everything's okay.
Health is just taken so much for granted, and when you're healthy, it's hard to imagine being ill.
But
then again, when you're ill or depressed or in pain, it's hard to imagine not doing those things.
For sure.
Part of human nature.
I would say one other thing. You're talking about sleep. Just I might as well bring it up. It just came to mind. Is that there are also many people who have sleep disorders, and I think that's something for another video for sure. But it's something that's so important. So many people go around with undiagnosed sleep problems, and they don't realise that those sleep problems have all sorts of other effects. One of them being possible problems with infertility, but there are so many other issues that can also bring up.
No, I couldn't agree more.
And that's easy. That's fairly easy to diagnose as well. There are home sleep studies that you can do where you put a device on your finger, on your wrist, and a little thing over here, and it can diagnose a number of different parameters and come up to say, well, okay, this is actually something that needs more attention. Yeah,
very important. Let's just leave GPs watching with one question they should ask every patient that currently isn't being asked. What do you think is the biggie that GPs are missing out on this?
I would actually say sleep is one of them.
Sleep, I would agree.
Sleep is very, very big and very underappreciated. And I can honestly say that for the first half of my career, it wasn't something at the top of my mind because we were never really taught about it in that respect. And I also think that we didn't know. It's
not in the textbooks.
It's probably becoming
filtering in
now. It's filtering in. I actually have a very close friend whom we have known each other for at least 25 years, a doctor, and he is a sleep specialist, and so I'm kind of lucky that over the years I've absorbed a little bit about what he's been doing, because his whole specialty only developed in that period of time. And so it's kind of, I don't want to say it's a new phenomenon, but the awareness and the research that's gone into sleep has really exploded in the last 15-20 years.
Really is a fascinating.
It really wasn't there before. We didn't appreciate before how important sleep is and what the functions of sleep are, and the glymphatic system, how the brain clears itself of various toxins overnight, and that only happens if you go through the right kind of sleep architecture, if you go through the right sleep stages. The
importance of dreaming, all sorts of things we could talk about, but fascinating for another lesson. Just any final thoughts on male fertility before we wrap this one up, Michael? Male infertility, male conceptual problems.
I would just say, only to come back to summarise, I guess, just to say that people need to be asking the questions and not just saying, well, I've got a problem with fertility, it's like, what are the things that could be causing this in the first place? They always come back to basics, and it's always go back to the why. That's all I could. That's the one thing that comes to my mind right now when you ask me that.
And to patients and couples, I would say that this is very common. This is almost normal.
At least in my experience as a family doctor, it's very common.
Yeah,
very common.
See someone who's got basic medical, who'll tell you all the basic things first, and that'll probably resolve the majority of cases, and just leave the high tech for the ones that can't be resolved by basic.
Definitely a significant proportion of cases. I don't know if it's the majority. It's not that I see every couple that has a fertility issue coming to see me, but very often they come through the GP, because the GP is the person who has to give them the initial test to work up the reasons for the test that they need for the fertility treatment that they may undergo. So very often we do see those couples. They don't all go directly to a specialist, and even if they do, they'll be asking us for tests. And so when they're asking you for tests, it's a great opportunity to invite them in and say, well, can we, and that's very often been the case. That's what's often happened.
Very much the case, yeah. And always think of the basic, simple lifestyle first, optimize health, and then it's nice to know we've got all the clever stuff in reserve. But hopefully, this common sense, general practice approach means that it's needed less often. Dr. Cohen, thank you as always. I've learned things. I didn't let on at the time, but I didn't know that a woman could release an ovum several times a month. I hadn't really. I suppose it makes sense because you can get twins, can't you?
Yeah. Well, I mean, it's just getting two ovums at probably around the same time.
Around about the same time, yeah. Twins is another fascinating topic, but not for today. So thank you, Dr. Cohen, and thank you for watching.